These Nigerian women are on a mission to convince as many girls as possible to get immunized against human papillomavirus or HPV. Their work is part of an official government program that began in October last year. The HPV vaccine can prevent cancers caused by a HPV infection, including cervical cancer, and is recommended for people aged 9 to 45. So far, their message is spreading well across the country and reaching remote areas such as this village in Oyo State in Nigeria's southwest.
We have heard about cervical cancer before now, and we are aware. That's why I asked my daughter to go get vaccinated as a preventive measure.
When the healthcare workers got here, they wanted to vaccinate my daughter. I asked about what it does. When they explained its benefit, that's when I allowed my daughter to be vaccinated.
The immunization program is spearheaded by the Nigerian government through the National Primary Healthcare Development Agency. It targets different age groups of girls across Nigeria's 37 states. The first phase aims at getting all between 9 and 14 years inoculated in 16 states. The second phase will involve everyone else.
It is very important for parents, healthcare workers and government to come together to work to make sure that the girls are vaccinated against cervical cancer. Because as we know, cancer is, let me say, it is a deadly disease if it is not prevented or if it is not detected early. But once a girl child is vaccinated, it prevents such a girl from having cervical cancer. And this reduces the burden that a person that has cervical cancer, the burden that anybody that has cervical cancer will put on the family and the government, as well as the health care workers.
Vaccinations against HPV are yet to be included in the immunization programs of about half of African nations, and that's having a devastating effect. According to the United Nations statistics, as many as 100,000 developed cervical cancer on the continent, with 70% of them dying. Cervical cancer is among the most common types of cancers in Nigeria. Latest studies show that as many as 8,000 people have died from the disease, based on 12,000 cases. Authorities hope their campaign can start to significantly reduce these figures. Wanjamungai, CGTN.